Hello everyone, it's April 23rd. I'm Dr. Adam London, Director of the Kent County Health Department. Across the state of Michigan, we're being told there are 33,966 positive cases of COVID-19, and 2,813 deaths. Here in Kent County, as of this morning anyway, we're at 797 cases of COVID-19, which is an increase of 47 over the same time yesterday. And we're up one more death to 26 deaths countywide. As I mentioned in the past couple of days, we've been looking more intensely at the most highest risk vulnerable communities, trying to find the virus and trying to find those who are at greatest risk of being infected. And that's intentional. You've seen our numbers increase. We're not worried so much about a line graph and the way a line graph looks. I'm much more worried about finding cases and making sure people get the care they need. And so right now we're aggressively looking for the virus and trying to find cases. We're not just passively waiting for cases to be identified. So I want you to know that as you're looking at that case count. I also want to thank a number of partners that have really helped us in the past few days aggressively hunt the virus and test people and find out if people who are at high risk have been infected. And I especially want to call out the good people at Mercy Health St. Mary's. Dr. Young Kim and his team have been amazing to work with in expanding our testing capacity and really making sure that people who are at high risk get tested. I also want to thank Tasha Blackman and the good people at Cherry Health. They've done an amazing job in the past week or so of expanding testing and especially making sure that that people in the urban center and people who might not normally have access to a healthcare provider are getting tested. And also Tina Fries-Decker and the amazing people at Spectrum Health. They're always there for us, and they're always a tremendous resource. In this case with COVID-19, making sure that the community has the beds and the ventilators to care for people and that the testing is happening in a timely way. We have amazing partners in the Grand Rapids inner city area helping to make sure that we can find cases and we can treat them in a really fast manner. And we're also seeing that testing is expanding, and it's expanding rapidly. In addition to these locations, Metro Health, U of M is doing testing, and Rite Aid in Kentwood is also doing testing, not to mention the health department's testing of those highly vulnerable populations. Right now we're looking at how do we further expand that screening, how do we make sure that we're getting to long-term care homes, how do we make sure we're getting to first responders and others that are on the front lines so they can be tested as quickly as possible. I also want to thank Bishop Walkowiak and the Catholic Diocese of Grand Rapids. The diocese has allowed use of their gymnasium at Catholic Central in order to house people who are negative for COVID-19 but who don't otherwise have a place to stay. It's very important that we space that population out as much as possible right now. And the Catholic Diocese has been a huge partner and a friend to us as we provide space and care for people who really don't have another place to go right now. We are, however, looking for volunteers to help us at that location, to help make sure that that place remains safe and the people there are well cared for. And so if you're willing to help us care for these people who've been tested and they're negative for COVID-19, I would encourage you to go to kcest.org/volunteer. And we're looking for people to help with all shifts in making sure that these people have great care and are well taken care of here in the days to come. That's all for today. I want to thank you for watching. I'm Dr. Adam London, Director of the Kent County Health Department, encouraging you to please stay positive, stay heroic, and stay healthy. Thank you.